I'm Theresa Richard. I've been a medical speech pathologist for 15 years. I'm a board-certified specialist in swallowing and swallowing disorders. I'm the founder and CEO of the MedSLP Collective and MedSLP Education.
Number 1, know your audience. In healthcare settings, different professionals are often given the opportunity to educate other healthcare professionals about certain aspects of their job. As an SLP, the education might be about what we do as a profession in general: communication, cognition, and swallowing, what that means and what our role is in patient care. What we do as speech-language pathologists is often a mystery to other professionals. In addition to the generalities of what we do, we may also have the opportunity to educate others about specific things in the SLP world: augmentative alternative communication, swallowing disorders, how to approach and communicate with a dementia patient, assisting patients with relearning communication after stroke. The potential topic list goes on and on. In order for what we say to our audience to make sense to them, we must understand where they are coming from and what their role is in patient care. Are we talking about MDs, CNAs, nurses, dietary? Who is our target audience? It makes sense that an in-service to CNAs will be different than a talk to registered dietitians or a group of physicians. Make sure to target your audience correctly. For instance, administration is going to care about patient care, but patient care in the context of cost and staffing concerns. CNAs are going to want to know how the aspects of what you are educating them on changes the care they give a patient and how they are going to manage their time and workload accordingly. Just keep in mind that your in-services are not one size fits all. Number 2, know what you want to convey. An SLP working in a skilled nursing facility was having problems with nursing, CNAs, and the dietary staff following the recommendations they were making for feeding, diet, and swallowing strategies. The SLP provided an in-service explaining the why behind a particular altered diet and strategies to be implemented at bedside. And guess what happened? Absolutely nothing. Things didn't change and just continued on as before. The strategies to decrease aspiration and allow the patient to continue an oral diet were not followed through with by the staff. Feeling incredibly defeated after spending a lot of time preparing for the in-service, preparing materials, and thinking they were presenting top-notch information to the staff, the SLP spent some time reflecting on what went wrong and why the information didn't just land with the staff. The SLP realized that maybe if they weren't hearing him, then possibly showing them might be the way. The SLP then decided to contact the hospital and get a video of the resident's VFSS. He went through the study, picked out the relevant information, and made sure the staff in attendance would see the aspiration as it occurred in the resident and see the strategy that prevented the aspiration. This time, nursing and dietary staff got it. Seeing the strategies come to life on video made all of the difference. The SLP got his point across, but most importantly, the patient was able to consume PO and eventually stop needing the strategies altogether as he regained his strength. The same therapist regularly presented to physicians and administrators about fees. He learned to include both the positive clinical outcomes and potential for interdisciplinary care with the positive outcomes of cost for the facility. It is so important to know exactly who we're speaking to and tailor our presentation to speak their language. Had he just concentrated on the care, the administrators might not have seen the value of the services. I'll be posting other videos just like this one that you won't want to miss, so make sure to hit that like and subscribe button and turn on the notification bell. Also, do you have any specific questions about in-services? Leave a comment below and tell me about it. We'll be sure to get your questions answered as soon as possible. Make sure to stick around to the end to claim a freebie or two. Number 3, know yourself. Nothing is worse than an unprepared speaker. Don't be that person. Not only should you know your material, but also know how the computer works, how the screen lets down, what your audiovisual system is like, etc. Remember the Boy Scout motto? Be prepared. Nothing will keep your intended message from getting across like the sense that you're not prepared. You might in general know your material, but can you roll it off your tongue without hesitation? Can you take questions from the audience without a hitch? Do you look like the expert that gives you the authority you want from your talk? Preparedness when giving a talk comes from practice and repetition of the material. Remember, you are the expert in this area in the room, so show up with that confidence. If you know you have to give an in-service, and you also know you tend to get nervous before you speak to an audience, find a friend or friends to practice on. You don't want your message to get lost because your voice and hands were shaking so badly in terror. Are you going to be using PowerPoint or another similar program? Make sure you know how it works, or just don't use slides at all. Make sure your slides and presentation are compatible. Make sure your videos or pictures show up, and if not, have a backup plan. Don't let technology be a negative distraction from your talk. It should only be a welcome addition if you use it at all. And here's a newsflash that might take the pressure off of you completely. Don't feel like you have to show up with slides or a formal presentation. Some of the best in-services are done informally, where you're just chatting and relaying information to the audience. After all, you want them to remember your talking points, not that you didn't know how to make the video play. If you're interested in learning even more about how to give in-services like a pro, check out this free in-service from the MedSLP Collective at medslpcollective.com/in-service. We'll stick the link in the description below. And if you'd like more community support and a group of mentors and SLPs to bounce ideas off of and grow with, then I invite you to check out the MedSLP Collective. There we have a bunch of done-for-you in-services that you can use whenever you need. Go to www.medslpcollective.com now to learn more.